Hello and welcome to our antenatal information video. We will be going through lots of advice and strategies to help you manage any discomfort you may experience throughout your pregnancy and help you answer any questions you may have. We will start with some anatomy. This picture is of a female pelvis, which has a large opening in the centre, which is the birth canal. There are joints at the back and front of the pelvis, and there are lots of muscles and ligaments which help to hold these joints in place. During pregnancy, there are many normal changes to the body which cause extra stresses and strains on the joints and muscles. Sometimes you may experience discomfort around the pelvis, as the body tries to cope with the pregnancy changes. However, this is completely normal. Focusing on the muscles within this area, there are several different muscles around the abdomen which are affected by pregnancy. The oblique muscles are attached around the sides of your waist, and these can widen during pregnancy. Down the centre are the rectus abdominis muscles, or six-pack muscles, which can separate later in the pregnancy to accommodate the baby growing. The transverse abdominis muscle is at the front of the lower tummy, which is very important to help support your core stability. As you go through your pregnancy, there are many natural changes that happen to the body, which affect how things work and how you feel. During pregnancy, normal hormone level changes increase muscle and ligament laxity, especially in the pelvis, in order to accommodate the baby and allow the baby to be born. You may need to modify your posture and movement patterns to cope with these changes. Hormones can also increase constipation, and it is important to manage this and avoid overstraining. Your lungs also change as the baby grows. The stomach and intestines are pushed upwards, so may be hard to take a deep breath. So towards the end of your pregnancy, you may feel short of breath. As the baby grows, these changes can also cause heartburn and acid reflux. These symptoms are all normal pregnancy-related changes and should improve once you have given birth. Weight gain in pregnancy varies greatly. Most pregnant women gain between 10 to 12.5 kilos, 22 to 28 pounds, putting most weight on after week 20. Much of the extra weight is due to your baby growing, but your body will also be storing fat ready to make breast milk after your baby is born. Putting on too much weight can affect your health and increase your blood pressure. It is important you eat healthily throughout the pregnancy, and staying active is also important in pregnancy. Keep up your normal daily activities and exercise as able, unless you have been advised to stop via your GP or midwife. If you are concerned about your weight whilst pregnant, ask your GP or midwife for advice. To help us manage these changes throughout the pregnancy, we need to adapt our postures and pace our activities. You may have to consider the best way to use your body to manage your tasks and plan your day of activities. For example, minimise trips up and down stairs and break up jobs as able, so you can rest in between. If you have an unavoidable busy day, you could try and make sure the next day is quiet so you can recover. Listen to your body in regards to any pain you may have and pace yourself. Posture also changes throughout pregnancy. Our back has normal gentle curves when you are not pregnant, where our lower back curves in and the upper back curves out. These curves are not affected too much in early pregnancy, but as the baby grows, the belly expands. This puts more strain on the lower back, which can cause pain in the lower back muscles. Similarly, as the breasts grow, this can put more pressure on the middle of your back between your shoulder blades. When standing in pregnancy, try to remember to keep your feet hip distance apart, knees are soft, tuck under your tailbone, pull your tummy button into your spine, lift through your breastbone, widen through your collarbones, and lengthen through the top of your head. Imagine a piece of string is attached to the top of your head, pulling you up towards the ceiling, and keep your chin tucked in. Wearing good supportive footwear during pregnancy is key. Shock-absorbing footwear, like trainers, are preferable. Avoid flip-flops or flat shoes like slip-on pumps and Uggs. Avoid wearing high heels because they change your posture and put extra pressure on your lower back and pelvis. The same principles apply in sitting. Try not to slouch and sit in well-supported upright sitting positions. Push your hips back into the chair and rest your back against the backrest, or use a small cushion to support your lower back. Your feet should be flat on the floor, with hips and knees at right angles. Ensure equal weight bearing through the pelvis, and do not slouch or hunch your shoulders. If working in a sitting position for long periods of time, also consider good supportive seating options. Consider the height of your laptop or computer, keyboard, and monitor. If using the phone regularly, you may benefit from having a headset. Your occupational health team can offer you advice and an ergonomic workstation assessment to check your office or home working environment. They can provide advice and equipment to support you as necessary. The key message is for you to change your position regularly, ideally every 20 to 30 minutes. Get up and walk around, improve your circulation, and stretch out tight muscles and stiff joints. There are lots of things you can do to make your day-to-day activities more comfortable. Everyone is different, but here are some tips. When walking, wear appropriate footwear, take smaller steps, and walk a bit slower. If you are carrying something, try and carry it evenly. For example, split the shopping into 2 bags and carry one in each hand. Take regular rests. When standing up from sitting, wriggle to the edge of the chair or bed, slightly widen your legs to allow space for your bump, engage your buttock muscles and pull in your lower tummy. Lean forwards, nose over toes, and come up into standing, using your hands to push up and for support. When going up the stairs, use the handrail if available and take one step at a time. If you have one side worse than the other, step up with the better leg. When coming downstairs again, take one step at a time, but this time lead with the weaker side. When getting in and out of the car, you might find it helpful to use a plastic bag to make it easier to move your legs into the footwell. Place the plastic bag on the seat, turn around, support yourself on the sides of the car, stick your bottom out and sit down. Swing your legs in, keeping your knees together, using the car for support. Sit evenly and straight, adjust your seat to an upright position, and you could use a small towel or cushion in your lower back for extra support. Adjust the seat so your feet are sitting comfortably on the pedals. Avoid stretching. Getting out of the car, give yourself plenty of space. Adjust the seat if necessary. Use the car for support, keep your knees together. Swivel or rotate to get your feet out of the door. Shuffle forward to the edge of the seat and stand up using the car for support. Ideally during pregnancy, it may be easier to shower rather than bathe. If you do have a bath, it would be good to have someone in the house to help you if you need it. Stand next to the bath, hold on to anything solid or secure for support, like a wall or hand basin, and step in sideways. Use your arms to support yourself on the side of the bath and lower your bottom in. When getting out of the bath, use your arms, holding onto the sides of the bath, bend your knees, walk your feet towards your bottom, push up through your arms, push down through your feet, and stand up. You may need help at this point getting up and out of the bath. When looking after young toddlers, encourage them to be as independent as possible. Try and avoid playing with them on the floor, as getting up and down may cause you pain. Instead, use a small stool to sit on when playing with them. Alternatively, try kneeling onto a cushion, then come up onto one knee, using a chair for support, and bridge the gap into standing. With small children, avoid lifting where possible. Go down onto one knee or squat to talk to them, or get them to climb up onto your lap for a cuddle when you are sitting. Encourage them to climb in and out of the car themselves if it is safe to do so. Try and encourage older children to do as much as they can to help out and prevent extra stress and strain on your body. Try to avoid lifting where possible. If you do have to lift something, Keep your feet hip-width apart. Try to lift from a surface rather than the floor. Bend your knees. Keep your back straight. Keep the load as central and close to your body as possible. With small children, avoid lifting where possible and encourage them to be independent, as previously mentioned. Avoid one-sided carrying of your child on one hip. Alternate between sides if it is necessary to do so. If you are struggling with your pregnancy, if possible, ask for help with housework from friends or family. If you do have to do housework, you may need to adapt your postures and pace your activities so your pregnant body can cope better. Spread the work throughout the week and break the chores into smaller tasks, ensuring you pace yourself and rest in between. Never blitz them in one go. Work within pain limits and energy levels. Avoid repetitive, aggravating movements or positions such as hoovering or sweeping and mopping. If you have to do these activities, then try to avoid seesawing back and forth with one leg in front of the other. Stand feet hip distance apart and move your feet around regularly or alternate the lead leg every so often. Sleeping can be a big problem in pregnancy, and often this is just the change in habit from sleeping on your front or back. Babies are often more active at night, and as the pregnancy progresses, you might be in more general discomfort. There are lots of things you can do to try to make sleeping more comfortable. Everyone is different, but here are some tips. Soften the mattress with an extra duvet or mattress topper under your sheet. Try and avoid sleeping in the fetal position, widen through your upper chest, one hand on your upper thigh, and one hand under your pillow by your head. Use pillows to support you between your knees, one underneath your bump and one in your lower back. If you are suffering from gastric reflux, it may be helpful to raise your head higher with more pillows, but make sure you are well supported. When getting in and out of bed, try and keep your legs together. Reduce the strain going through your tummy by lying down onto your side and bringing your feet up. Then roll onto your back and push through your feet to move your bottom across to get comfortable. When getting out of bed, keep your knees together, turn onto your side, then drop your feet down and push with your upper body into sitting. Exercise in pregnancy is very much advised. It has been shown to be good for your well-being, promotes sleep, and enhances circulation and cardiovascular health. The Department of Health provide guidelines for recommended levels of exercise to do when you are pregnant. This is 150 minutes of exercise a week, ideally broken down into 30 minutes a day, 5 days a week. Generally, low-impact activities are best, like walking, swimming, and pregnancy-related classes. Any sports that you have done prior to pregnancy can be modified for the different stages of your pregnancy, but it is advised not to start any new sports that are not pregnancy-specific during this time. Avoid all contact sports or sports where there is a risk of you falling. Aqua bump, pregnancy Pilates, and pregnancy yoga are all good examples of how you can safely stretch and exercise your body. It is, however, common to feel a lot of fatigue during pregnancy, so try and pace yourself and ensure you have appropriate rest days in between energetic days. If you have any questions relating to your pregnancy or need further advice or support, then please do not hesitate to refer to our perinatal pelvic health services and request an appointment with a qualified physiotherapist.